Ella, which is in the group of urogenital system and sex hormones drugs, is sold in one tablet of 30 milligrams. The active ingredient of Ella is Ulipristal Acetate. What is Ella and what is it used for? Ella is an emergency contraceptive. It works by stopping or delaying the release of an egg from an ovary. Ella may also make it harder for a fertilized egg to attach to the uterus. Ella is used to prevent pregnancy after having sex without using a condom or other effective birth control method. Ella is also used to prevent pregnancy after a regular form of birth control has failed. Things to know before using Ella are: before taking Ulipristal, tell your doctor or pharmacist if you are allergic to it, or to progestins, or if you have any other allergies. This product may contain inactive ingredients, which can cause allergic reactions or other problems. Talk to your pharmacist for more details. This drug may make you dizzy. Alcohol or marijuana can make you more dizzy. Do not drive, use machinery, or do anything that needs alertness until you can do it safely. Limit alcoholic beverages. Talk to your doctor if you are using marijuana. Before having surgery, tell your doctor or dentist about all the products you use. This medication must not be used during pregnancy. If you become pregnant or think you may be pregnant, tell your doctor right away. This drug passes into breast milk. Because of the possible risk to the infant, breastfeeding while using this drug is not recommended. Consult your doctor before breastfeeding. Ella is not to be used as a regular form of daily, weekly, or monthly birth control. Ella should not be used to terminate an existing pregnancy. If vomiting occurs within 3 hours of taking Ella, the dose may not be effective and another dose is likely to be needed. Ella can be taken at any time during the menstrual cycle. How to use Ella? Read the patient information leaflet, if available from your pharmacist, before you start taking Ulipristal. If you have any questions, ask your doctor or pharmacist. Take 1 tablet by mouth with or without food as directed by your doctor as soon as possible after unprotected sex. This medication works best when it is taken within 120 hours after unprotected sex. If you vomit within 3 hours of taking this medication, contact your doctor to ask if you need to repeat the dose. After you take this medication, the time when your period comes and how much you bleed may change. Tell your doctor right away if your period is more than 7 days late. You may need to take a pregnancy test. After using this medication, you should use a barrier-type birth control every time you have sex until you have your period. If you use or wish to use hormonal birth control, wait at least 5 days after using this medication before starting hormonal birth control. Continue using a barrier-type birth control until your hormonal birth control takes effect. If needed, talk to your doctor about reliable forms of birth control. What are the side effects of Ella? The most common side effects of Ella are headache, nausea, and abdominal or stomach pain, dizziness, tired feeling, or menstrual pain. This is not a complete list of possible side effects. If you notice other effects not listed above, contact your doctor or pharmacist. If this video was helpful for you, like the video and subscribe to the channel. I wish you healthy days.